Hi, everyone. Welcome back. Today, we're joined again by Dr. Eddie Stenehjem to talk about our COVID-19 update. Eddie was out last week, so we're going to do a little bit of a 2-week update and kind of see how we've been doing the last couple of days. Eddie, thanks again for joining us. We really appreciate it.
Thanks for having me back.
So, as always, I want to talk about case count first and kind of talk about what's been going on in the community. These are yesterday's numbers. Today's have not been reported yet, so just keep that in mind if you're watching. But the case counts yesterday were 15,839. We were at 152 deaths and 1,120 hospitalizations. And over the last 7 days, our case counts daily have been over 300, which is a lot larger than they were in April. Eddie, why do you think we're having such a big increase in case counts right now?
I mean, it's pretty simple. I mean, this is what we expected to see when, the community and the economy starts opening up, and viral transmission hasn't changed. So what we're seeing here is kind of the expected increase. It really, started after the Memorial Day holiday. So if you take the Memorial Day holiday, add 10 days, that's really when we started to see this increase. And that's really the same time when we saw a lot more people being engaged in the community, being out and about. And we also don't have kind of universal mask wearing. So unfortunately, this is the trend we expected when we didn't have control over the virus and our communities and economies opened up.
Back in April or even early May, did we think there was going to be a large increase in June? Was that something you guys had kind of started to see and expect because of the different holidays that were happening? Or is this taking a little bit of a different trajectory than we were thinking?
Yeah, if you look back and we kind of look back on our forecasting back in April and May, we had a number of people putting together different models. Models are trying to predict the future of the coronavirus epidemiology. And when you input into those models changing in social distancing, and we put into those models where if we kind of took away a lot of that, this is exactly what we predicted to see. And so back in April, when we were having lower numbers and we were being very cognizant of social distancing, schools were closed, people were staying home, we were pretty optimistic. But that optimism was really dependent on us continuing that trend of social distancing. When we factored in then what would happen if we took out social distancing and really relaxed those standards, this is exactly what we anticipated to happen. And now we're seeing really significant increases in case counts across the state of Utah.
We also know too that there's been protests throughout the last couple of weeks happening. Are we starting to see some of those cases? I know you can't directly correlate that, but do you think it's possible that some of those numbers are now starting to be reported in the daily case count, or is it still a little too soon for that?
No, it's not too soon for it. I think it's just really hard. I listened to Angela Dunn talk about this. She was asked that same question. And, she reflected on how challenging it is to really pin specific cases to those protests. And so I suspect that there is a signal in there. And I know the Department of Health is looking for that signal. But we can't definitively say one way or the other if it was from the protests or not. I think it's just more of the fact that our community is more engaged in the community and relaxing our social distancing standards.
I know that every time I go somewhere now, I feel like I see less and less people wearing a mask, which is really interesting to me because you'd think as we'd start to open up the economy more, that people would be a little bit more cautious of what's going on, but it doesn't seem to be that case. And it was announced today, there's 9 or 10 counties going into the green, which means a little bit different than it used to mean. We saw that Governor Herbert actually changed his green guidelines. It used to say masking was not required or recommended, I should say. And now he is recommending if you're in that green county that you do wear masks. These counties are very rural, so they do not have a lot of the population. I think he said it was 3% of the population resides within these 10 different counties. But why is it important for those people to still follow the guidelines and still stay safe, even if they're not in a giant area with a big spread?
Right. I mean, I think it just brings up the importance of masking. We can't understate this at all. I mean, there's an example recently in the press about a hair salon in Missouri, where there's two hairstylists, both of whom were infected with COVID-19. But all of their customers were required to wear masks, and the hairstylists were also wearing masks. And there was well over 150 people exposed at close range. I mean, we're talking, matter of a couple feet as you're getting your hair cut by somebody with infected with COVID-19, and nobody got infected. And the reason nobody got infected was because both people were wearing masks. And that should really just be an incredible example in terms of the utility of wearing a mask, and the prevention that really it provides. And so, regardless if you're in a rural area or an urban area, this is the time to be wearing a mask in public. Masks have been shown now repeatedly through a number of different studies to really reduce the amount of infectious particles that are originating from you, going out in the community, and then also protecting you from infected droplets from others. And so wearing a mask is really a sign of respect for public health. I mean, that's what it should be, seen as. And everybody should be really doing that, regardless if you're in a grocery store or anywhere out in the community. Wearing a mask is so important. In the rural settings, you're right, they have gone to green. They've had really low rates, but we also are seeing pockets of infection there as well. The challenge with the rural communities is that there is no leeway in terms of healthcare and access to healthcare. It is very limited in rural communities. And so even a few infections in a rural community can really task the healthcare infrastructure in those communities. And if somebody, Salt Lake County is the highest case counts, are now going into those communities and bringing virus with them into those communities, we need to protect those communities by wearing a mask. And so it really should be just part of our everyday life in terms of wearing a mask kind of going forward, especially with case counts that are, doubling.
Yeah, you bring up a good point about someone traveling down to that area. I know a lot of people want to go camping and go to the lake and kind of explore new areas of Utah while they can, and while it's not 100 degrees quite yet. But it is important to note that if you're going to go do that, to have a plan on how you interact with the people that live there. Maybe camp in a tent as opposed to staying in a hotel, because then you're reducing the impact of actually ever seeing someone. But it is interesting to look at. I know that I'm going camping next weekend, and I will definitely consider where I'm going based upon these green counties to make sure that their healthcare systems are not overwhelmed. So that's a good point.
Yeah, and I think, you definitely can recreate safely, but you have to be very intentional about it. And so really thinking about who are you going with and how are you getting there? Are you spending 2 hours in an enclosed vehicle, an enclosed car with people that haven't been practicing social distancing that could very well be infected? You really have to be thinking about that. Where are you going to eat? Are you going to stay? Are you going to go stay in a VRBO or a hotel? Are you going to camp? Whatever it might be. You really just have to be very intentional and think about it. And if you are going to be interacting with those communities in those rural areas, how are you going to keep them safe? And how are you going to kind of interact and wear a mask and do all those things? Is really important to think about ahead of time.
Another thing I want to bring up too is testing, and the fact that we've had all these large amount of cases daily. People automatically think, okay, higher case count equals more testing, which isn't necessarily true. Do you want to talk a little bit about the testing that's been happening in Utah and whether that statement is true or false?
Yeah, this statement is undoubtedly false. If you look at our testing pattern over the past 3 months in the state of Utah, what you'll see in the past 2 weeks is our number of tests haven't changed. Our number of tests, I'm looking at the chart right now, goes between 3,500 and 4,500 tests per day. And that really hasn't changed going back into mid-April. And the other key kind of metric we look at is the test positivity rate. So back in March and April, we had about 4 to 5% of every test, of all the tests that are done on a daily basis were positive. About 5% per day were positive. That test positivity rate now is 8 to 10%. And so it's significantly increased. And if you were just to increase the amount of tests that you've done, yes, you're going to find more cases, but your test positivity rate is going to go down. And so what we're seeing is your test positivity rate going up in the face of the same number of tests. And the other thing that should be pointed out is that at least Intermountain, we're not doing any high intensity testing right now in particular areas. We did that up in Summit County about a month ago. We did it down in Utah County. We haven't done that. And so the tests that you're seeing now reported are just people presenting with symptoms to get tested. And so unfortunately, the number of increased cases is not a byproduct of just testing patterns. It's a byproduct of the fact that this virus is transmitting in our communities more and more.
Yeah, when people look at the Utah government's coronavirus website, I think it's a little bit confusing, the numbers that are on the site. You see the case counts, but that's over the last 4 months. It's not right now. So I think it's important for people to look at that positive case rate count and whether that's increasing or decreasing. And then the hospitalizations, I know we talk about a lot of times, or our ICU beds at capacity, how are we doing with that? So if you really want to look at the data, I think those are the two important numbers to look at. Is that right?
Yeah, absolutely. So there's a number of different data points you can look at. I would ignore those frontline numbers in terms of total number infected and those things. That just does not paint a good picture of where we are each day. So the number of new infections per day is a very good number to look at. Even probably better is the number of new infections per week. It takes out some of that noise we see in a day-to-day and different testing patterns over the weekend. So if you look at weekly new case counts, that's probably the best and most stable. And what you've seen is that's rising. The other point that you bring out is I'm looking at hospitalization rate. And so that's a metric we look at a lot within Intermountain. And what we've seen is that we were really kind of stable at about 70 to 90 patients with COVID-19 in our hospitals across the system for about a month. And now over the past 2 weeks, we've seen that number really shoot up. And now today, our census is 135 patients with COVID-19 in our hospitals across the state of Utah. That's the highest it's ever been. And so these are people that are sick enough where they warrant admission to the hospital, and almost half of them are in the intensive care unit receiving high level of care. It would be ventilators, high flow oxygen, those types of things. And so when you combine the state-based epidemiology data showing the numbers going up with our data showing that our hospitalizations are going up, this paints a not a very rosy picture for us for the next few months.
Yeah, and I think that is very important. Ignore those frontline numbers. Try to get a little bit more information, especially because the news is putting out those frontline numbers, and that's what they're talking about. So look a little bit deeper. I want to address a question we just got on Facebook Live too. Someone asked about an outside barbecue and if they should be wearing a mask if they're in that situation or not.
Yeah, I mean, I can kind of reflect in terms of how my family's dealing with these things. An outside barbecue with a limited number of friends and family, all remaining outside, limiting any kind of sharing of cups and glasses and drinks, I think can be done relatively safe, especially if you're cognizant of remaining kind of socially distant. So not being up in front of somebody's face, but trying to be a little ways apart, 6 feet ideally. And limit the number of people you have over. That's what we're doing. If you're increasing the number of people, then yeah, masks are important. But being outside where you've got a lot of airflow, I think is going to be really protective. And we haven't seen a lot of outbreaks from little family barbecues like that. So I think those are things that can be done safely with limited amount of people, and just being really cognizant of kind of physical distancing during that time. And that's how we're handling it as a family. But we're also being really cautious of who we're inviting into our backyard, who we're inviting into our barbecues. These are people that we know and we trust, and they themselves have been really doing physical distancing. And we say, okay, that's a risk that we're willing to take, as long as we kind of, put in some precautions. We don't have people in the house. We limit it to all outside. And that really, I think, decreases your risk for transmission.
What about little kids? Like if you have little kids that can easily run around and the concept of socially distancing is a little bit harder for them because they want to go say hi to their friends. How does that work? Is that kind of the same thing? Trust or look at the source of the people that are around you. If the whole family's run social distancing and the kids run up to each other, what are you supposed to do with that?
It's really hard. I mean, we have an almost 2-year-old who it's impossible. She'll put everything in her mouth, and she'll, run around and, hug people. And, it's almost impossible to do, physical distancing with small children. And so you really have to then start thinking about, okay, who are the people coming into our homes or coming into our backyards? How is our children kind of interacting with them? What is the risk if your child were to get it and then pass it on to you? You really have to factor those things in. And, with children, I would really focus on who are they playing with, and having some, potentially tough conversations with your friends that also have children. And if they're not really being physically distant themselves, then really think about whether or not that's a playmate you want to be involved in your home.
Yeah, those conversations will probably be a little bit difficult, but hopefully they understand. And this hopefully won't be like this forever. Last question for you about the social distancing too. So schools, a lot of schools in Utah, universities specifically, have announced kind of what they're planning on doing for fall session. And they talked about the fact that teachers and students will be required to wear masks when physical distancing is not possible and in a classroom setting. Can you talk about the importance of that specific situation of a large group of people being in one spot for a long time?
Yeah, large groups of people being indoors at the same time makes me very nervous. The way you get around that, and that's regardless if it's a school or church congregation, a basketball game, whatever it might be, it's all the same, from my perspective. It's really a focus on masking. Everybody needs to wear a mask, and making sure that the school have plans to really separate people by ideally 6 feet. And then also focusing on hand hygiene. If those things are put into place, I think you could probably go back to school relatively safely if people are masked, washing their hands, and are appropriately distanced. Large congregate class settings of hundreds of people, that's not going to be possible. And so, schools and colleges really have to make plans for that. And, those freshman classes that are 500, 600 people, those are the classes that you'd worry about and have to move on online. It's hard to predict what's going to happen in the fall. Our case counts right now, in terms of them going up, if that were to continue, I would have a hard time thinking that school can be done safely. And so ideally, we would really like to see a declining number of case counts before the fall to even consider going back to school, even if it is in a socially distanced way.
Yeah, the hard part for me to think about is elementary schools, and we just talked about kids. Like, keeping kids away from each other seems like a very hard feat. So I'll be interested to see what happens. I know that the universities, what I read today, they do have contingency plans about how that'll work. If the class is too big, it goes online and stuff like that. The last thing I wanted to touch on today was vaccines, and whether we're anywhere closer. Someone also just commented that they asked if it's true that we found a treatment for COVID, which I'm pretty sure the answer is no.
Yeah.
But do you want to talk a little bit about vaccines and kind of an update on where we're going with that?
Yeah, I can take that first question about we found a treatment. So I think that person is referring to the headlines about the UK recovery study finding that dexamethasone improved mortality. That's the most recent treatment that has been in the news as of late. Dexamethasone is a steroid we've used in healthcare for decades. It's a very blunt tool to decrease the immune response in patients. We have not seen the data. We have not seen the paper that really highlights its utility in terms of who benefited, what was the patient population like. All we have are headlines that show that it decreased mortality, especially in those that are in the intensive care unit on ventilators. And so this is something that we're going to be looking at closely. I can tell you, in other coronavirus infections, MERS-CoV, the original SARS, steroids didn't help. And so we're a little bit skeptical about it. We really need to see the data. It's really hard for us to base any decision from a treatment standpoint based on headlines that we're reading on CNN or Fox or wherever it might be. So we really need to see that data to really get into the details of whether or not that works. So that's the most recent report on treatment. It's not going to be a panacea. It's not going to be a cure-all, but it may decrease mortality, which would be wonderful. But we'll be looking at that data. In terms of vaccines, lots going on in vaccines. There's many vaccine targets that are being pushed forward. There's probably 8 to 10 front runners with all different forms of vaccines. There's the kind of standard purified protein vaccines that we're all used to getting. There's also new technology, RNA virus vaccine, DNA virus vaccines, adenovirus vaccines. These are just different methods of getting either RNA or DNA into your system, so then your body can produce a protein which you can then develop immunity to, which prevents you from getting SARS-CoV-2. All of these are in different stages of development. The United States has financially supported 5 of the front runners, and to really kind of augment the process of getting things moved through phase 1, phase 2, phase 3 studies. We anticipate that there will be large vaccine trials starting some of the US and definitely abroad as well, probably this summer. I would imagine earliest would be in July to start seeing some phase 3 trials. And maybe if everything goes very, very well and the vaccines are proven to be effective, we may start seeing vaccines being available this winter. But that's really a huge gamble. So keep in mind that only about 6% of vaccines that are being pushed through clinical trials are actually successful in terms of preventing infection. And so all of these vaccines that we're pushing forward, these potentially 10, 20, 30 different vaccine targets that are pushing forward, they're not all going to be successful. And there's going to be lots that fail. And we want to be able to fail quickly and find things that work. Best case scenario, we're talking maybe limited amounts of vaccine by the winter. And that's if those few front runners are actually found to be successful. And so there's a lot being leveraged on this, and we're watching this really closely. And fingers crossed, we'll see what comes out of these phase 3 trials.
I think it's important to note too about vaccines that they only work as well as people taking them too.
Right.
So once the vaccine is gone through the correct clinical trials, it's been approved and accurately looked at, then it's up to us to actually go get the vaccine and to take it. So especially, I know we talked about this in the past with flu season coming down the road for the fall. People really need to make sure they go get their proper vaccinations so that we can help reduce the load on our hospital system as well.
If there's ever a time to get an influenza vaccine, it's this fall. We have to ensure that we have close to 100% compliance with influenza vaccine across our communities. No ifs, ands, or buts about it. This is not something that we should even question. Everybody needs a flu shot next year to really decrease the burden on our healthcare system. Everything we see points to a resurgence of SARS-CoV-2 in the fall. And so we really need to do everything we possibly can to decrease the burden on our healthcare system. And one of the things we can do is flu shots. And so that's going to be very, very important. And in terms of the SARS-CoV-2 vaccines, there will not be enough vaccine for everybody to get a COVID vaccine from the get-go. And so we will, have to look at how many vaccines, if they come, how many vaccines do we have access to, who's going to get them, who are the highest risk people, and how do we prioritize that? And so you're absolutely right. Vaccines don't work if you don't get them.
Yep. Well, Eddie, thank you again for joining us. We really appreciate all the time. And if anyone would like additional information about getting screened or tested for COVID-19, they can call our COVID-19 hotline at 844-442-5224. We also still have our emotional help relief hotline available 7 days a week from 10 a.m. to 10 p.m. And that phone number is 833-442-2211. Thanks, everyone. And thanks, Eddie. We'll talk to you guys next time.